next three videos are of the elbow and the wrist. The first technique will be for tennis elbow. Tennis elbow is a common injury that occurs when a lot of people are playing sports such as tennis, golf or cricket. The injury to the tennis elbow occurs to the extensor tendons which run on this side of the forearm. The aim of the taping technique is to offload the tendons before they attach into their attachment site at the elbow. For this technique, I always use the hyperallergenic underlay. The tape should be approximately 5 centimetres below the elbow joint. After that, using the tape, I always use 2 to 3 strips running from the outside of the arm towards the inside of the arm. Again, you will get some folding or puckering of the skin in the tape, but that's needed to apply the appropriate force. Starting from the outside, lift the skin up and run to the inside. And I'll apply a third piece. Depending on where the patient's symptoms are, the tape can be moved more towards the elbow or a wrist, or towards each side as appropriate. But just make sure there is some puckering of the skin to allow the appropriate force of the tape to offload the tendons.